Hey, I'm Greg, the founder of More Performance Health in Plymouth, Michigan. I want to talk to you a little bit about the experiences I'm having using Shockwave with my patients. And before I do, I want to talk a little bit about why I chose to get this machine. From a patient standpoint, one of the things that I was struggling with was treating chronic tendinopathies. What's one of those answers for chronic tendinopathy? Well, it's definitely Shockwave Therapy, and it's bared out in systematic review upon systematic review on plantar fasciitis, on tennis elbow. There's a whole lot of information about how Shockwave Therapy is successful in helping people decrease their pain with chronic tendinopathy. So from the patient standpoint, that's the reason that I chose to get a Shockwave, not from my practice standpoint, but at least from the patient standpoint. So now I want to talk to you a little bit about what am I seeing? Okay, I did the research, I looked at that, but in practice and in actuality, what am I seeing? And I kind of say it's like a 40-40-20 split. So you have 40% of people who are getting 40-50% improvement. They're getting that mid-range improvement. They're making some improvement using the device. You have another 40% who are getting mind-blowing response. One Shockwave treatment, you're getting an incredible pain relief. And I want to make a statement about that. Being that they have that pain relief doesn't make it so that you can just throw away your protocols and just load the tissue. You still have to be smart about your progressive loading. But I am having 40% of those people that are having mind-blowing relief using the Shockwave device, and they can't believe it. And honestly, I used it on myself. The first night I got it, I put it together, I had a busy day. 11:30 before I went to bed, I said, I gotta go play with my new toy. I had a little runner's knee, I shockwaved it, I got up, I bounced, it no longer hurt, it was crazy. So, I've felt it on myself, I'm seeing it with my patients. And then lastly, that last 20%, those patients, they're not really getting the relief. So there are people who aren't gonna respond. Those 20% of people are the people that I'm referring back to the doctor, or if they haven't been to the doctor and they've come to me first, I'm referring them to a doctor that I know can help them. Most likely I'm gonna use a doctor that's primary practice sports medicine, their tendinopathies, you can ultrasound that. It's a quick way to get a good look inside. The guys that I know have good ultrasound skills, and usually what I'm finding is oh, poof, no wonder it wasn't gonna work, because there is a tear in there and they need to, or there's so much scar tissue that they need to have a 10X or some other medical intervention that progresses them forward. So a 40-40-20 split, pretty good relief, amazing relief, 40-40, 20% not responding. Now we know we need further medical management, and that's the process that I've been going through.